Hi, my name is Marissa Wilson. Here is my student ID, and I will do a 360 of the room. Okay. Hi, my name is Marissa Wilson, and I'm going to be conducting a cardiovascular exam on you today.
Okay.
Okay. First, I just gonna have you turn your head that way just a little bit. Okay. And then can you turn your head the other way? Okay. Um, his jugular was flat with no pulsation. Same with his carotid. There were no pulsations seen bilaterally. Next, I'm just going to take a look at your abdomen. The point of maximal impulse is at the fifth intercostal space, mid-clavicular. There are no obvious pulsations present. Okay. Next, I'm just going to just feel your carotid pulses. Okay, and the other side. Okay, pulses were +2 with no thrills. Next, I'm just going to put my hand on your chest. I'm going to feel for the angle of Louis right below, like right above the sternum at the mandibra. Okay. No pulsations felt. Next, I'm going to walk down to the second intercostal space on the right and feel at the angle of Louis. No pulsations. Then I'm going to walk across to the left second intercostal space. No pulsations. Then I'm going to walk down to the fifth intercostal, fifth intercostal space for the tricuspid area. No pulsations. And then I'll come down to the fifth intercostal space, mid-clavicular, and feel for the mitral area. There's no pulsations there either. Next, I'm just going to feel right for the, maximal impulse. Okay. It's brisk and tapping. Amplitude is about 2 centimeters. Okay. Next, I'm just going to take a listen to you. Okay. I want, every time I put my stethoscope on you, I want you to hold your breath. Okay? Hold your breath. Okay, hold your breath. Hold your breath. Okay, and hold your breath. Okay, you can let your breath out. There were no bruiries heard. Next, I'm going to do the same thing, but you do not have to hold your breath this time, okay? Okay. Normal rate and regular rhythm. It was absence of murmur, and there were no extra sounds like clicks, S3, S4, or rubs. Next, I'm going to have you lay on your left side, please. And I'm just going to listen again, all over again. And so you just lay there and breathe normally, okay? Again, no S3, S4 murmurs or clicks heard. I am going to have you sit up again.
Sit up.
Sit up, yep. Like you can sit up over with your legs over. And this time when I listen to you, I want you to lean forward and like exhale out, okay? Okay, do it again. Okay, and one more time. Okay. No murmurs heard. You can lay back if you want. No, like lay back. Okay. Next, I'm just gonna take a look at your arms. I'm gonna look at your nail beds, okay? Just gonna push some of these. Right now, I'm just looking for the blood flow to your hands, okay? Bilateral arms were symmetric with no swelling noted. Nail beds and skin is free from cyanosis or pallor. Okay, next, can you uncross your legs for me so they can see? Just look at your legs. I'm going to do the same thing with your toes. His legs also were symmetric with no swelling, no cyanosis, redness, or pallor, no rashes, ulcers, or scars, even hair distribution throughout both legs. And then, can I have you stand up real quickly? I just need to assess your legs. Okay. And then no varicose veins present either. Next, I'm just going to feel some pulses. Okay. Radial pulses were +2. I'm just going to feel right up here. Okay, and then brachial pulses were also +2. I am just going to feel right back in here, just feeling for some lymph nodes. Okay. Let me feel this side too. Lymph nodes bilaterally are soft and mobile, non-tender, and they're symmetric bilaterally. I already did his capillary refill on his fingers, and it was less than 3 seconds. Same with his toes. The capillary refill was less than 3 seconds. And then, real quickly, can I have you lay back down so I can assess your pulses on your feet? Okay. Feel your dorsalis, pinkus pulse. Both dorsalis pedis pulses were +2. And then I'm going to feel your posterior tibialis pulse. Okay, posterior tibialis pulses were +2. I'm going to feel your popliteal pulse, okay? Okay, on this side. Okay, popliteal pulses are +2 bilaterally, and then I just need to feel your femoral pulses. So I'm just going to pull your pant down just a little bit, okay? Okay, let's do the same thing on this side. Okay, femoral pulses were +2. I'm just going to feel up here for some lymph nodes, okay? Okay, inguinal nodes are also soft, mobile, non-tender, and symmetric bilaterally. Okay, next you can sit up. Okay. I'm going to do what's called an Allen's test, okay? So I'm going to occlude both your radial and ulnar pulse arteries until your hand turns white. Can you straighten your hand out? Actually, can you make a fist? Sorry. Thank you. Okay. And then open your hand. Perfect. Okay. We're going to do it again, and I'm going to release the other side, okay? Make a fist for me. Open your hand. Perfect. I'm going to do the same thing on this side, okay? Open your hand. Okay, perfect. Make a fist. And open your hand. Okay. Both hands were turned back to normal color within 6 seconds. And then next, I just need to check for adrenal insufficiency in your lower extremities. Okay, so I'm going to have you lay back down. Sorry. Okay, I want you to raise both legs until they start to turn a little pale. Okay, and then I want you to sit up. Okay, both feet were turned back to pink within 10 seconds. Same with his ankles, both returned back to normal color within 10 seconds. While I'm here, I know I did it earlier, but no pitting edema in the lower extremities either. Okay, thank you.